नमस्कार। राजधानी पैरामेडिकल ग्रुप ऑफ कॉलेजेस की तरफ से पैरामेडिकल के अंदर डीएमएलटी फर्स्ट ईयर के हेमेटोलॉजी और ब्लड बैंकिंग के कुछ सॉल्व्ड क्वेश्चंस हम इस वीडियो के अंदर दे रहे हैं, जिससे बच्चों की हेल्प हो जाए। जो क्वेश्चंस बार बार रिपीट होते हैं, इम्पोर्टेंट हैं और एग्जाम्स में आते रहते हैं, उन क्वेश्चंस को लेकर हमने कुछ ब्रीफिंग बनाई है, जो कि हमारे यूट्यूब चैनल राजधानी मेडिकल क्लासेस के ऊपर अवेलेबल हैं और हमारा जो ऐप है ऑनलाइन है उसके ऊपर राजधानी group.co.in के ऊपर भी अवेलेबल है। इसमें पैरामेडिकल, जीएनएम और फार्मेसी तीनों के ही सॉल्यूशंस भी अवेलेबल हैं, पूरी क्लास अवेलेबल है, वीडियो रिकॉर्डेड क्लासरूम्स भी अवेलेबल हैं, क्वेश्चंस भी अवेलेबल हैं, पेपर्स भी अवेलेबल हैं और शॉर्ट पेपर्स पिछले सालों के भी अवेलेबल हैं। आप डाउनलोड करके वहां से देख सकते हैं। पहला है डिस्क्राइब द हीमोग्लोबिन एस्टिमेट इन डिटेल विद मेथड्स। सेकंड है डिस्क्राइब पीबीएफ इन डिटेल विद द लेसमैन टेस्ट। शॉर्ट नोट्स हैं ईएसआर, मेजर ग्रॉस मैच, पीसीवी, एबीओ ब्लड ग्रुपिंग, डिस्क्राइब द डिटेल ब्लड कंपोनेंट एंड मेकिंग प्रोसीजर ऑफ देयर यूज। फिफ्थ शॉर्ट नोट्स हैं सिकल सेल सिकलिंग टेस्ट, G6 PD टेस्ट, RB peptide DU test, describe the combo test in detail with ICT. Short notes on lumbar puncture, donor selection, hemolytic anemia, Lumbar chamber. अब इनके आंसर्स हैं जो डिटेल में हम आपको पूरा डिस्क्राइब करें। डिस्क्राइब द ESR इन डिटेल मेथड। ESR का पूरा नाम है इरेथ्रोसाइट सेडिमेंटेशन रेट, सेड रेट भी बोला जाता है इसको, और इरेथ्रोसाइट सेडिमेंटेशन रेट भी बोला जाता है। इस ब्लड टेस्ट दैट कैन रिवील द इन्फ्लेमेटरी activity of our body. A SAT test isn't stand-alone diagnostic tool, but it can help our doctor to diagnose or monitor the progress of an inflammatory disease. Aim क्या है इसका? ESR test can detect the inflammation that may be caused by infection or some autoimmune disease. It detects the severe infection stage in the human body. ESR test can be detect stage of TB and cancers also. It can also define the rate which red blood cells sedimentation in the period of 1 hour. Method of ESR determination are two methods. एक तो विंट्रॉप मेथड है, दूसरा वेस्टर्न ग्रेन्स मेथड। वेस्टर्न ग्रेन मेथड में प्रिंसिपल ये है एंटीकोगुलेट ब्लड इज अलाउड to stand in a vertical position, western gain tube, then RBC tend fall to the bottom of forming layers in the lower layer of RBC and upper layer plasma. This occurs in three stages. Stage of aggregation. It is initial stage in which the piling up of RBCs take place. The phenomena is known as Rolex formation. It occurs in first 10 to 15 minutes. Step is very slow. Stage of sedimentation. It is a state of actual falling of RBC with sedimentation occurs at constant rate. This occurs in 30 to 40 minutes out of 1 hour, depending upon the length of the tube. This is the fast sedimentation of RBC. Stage of packing. This is final stage, is also known as a stationary phase. In this, there is a slower rate of falling during which packing of sedimentation RBC in column occurs. Due to overcrowding, it occurs in 10 minutes in 1 hour. The sedimentation again goes slow because it's final stage of packing the cells. Equipments western tube के अंदर it is a 30 cm length and 2.5 mm in diameter. Tube, the lower 20 cm are marked 0 at the top and 200 at the bottom. It contains about 2 ml of the blood. Westergren stent, test tube, sodium citrate 3.8 grams, anticoagulant and pipette. Procedure है, it will take 1.6 ml of anticoagulant blood in the test tube with the help of the pipette. Take 0.4 ml sodium citrate solution in the same tube with the help of the pipette. Apply the western tube in the test. Fill the western tube with this solution of 0. Stand Westergen tube with Westergen stent for 1 hour. चेक द रिजल्ट आफ्टर 1 आवर। रिजल्ट नॉर्मल वैल्यूज है 0 से 15 mm पर आवर, फीमेल के अंदर 0 से 20 mm पर। ये इसके फोटोग्राफ्स हैं। सेकंड है डिस्क्राइब द पीवीएफ डिटेल इन लेसमान स्टेन। A peripheral blood smear (PPF) is a glass microscopic slide coated on one side with a thin layer of venous blood. It provides the information of the red cells, leukocytes, platelet count, and structure of the blood cells. Any parasite is present in the can be identified by the smear. Abnormal cells can be detected on PPF. Equipment: microscope slide, glass thread slide, सेडार वुड ऑयल, इमर्सन ऑयल भी बोलते हैं इसको, लेसमान स्टेन, स्टेनिंग क्रैक, कॉटन टिश्यू पेपर, पिपेट टैंक। पीपीएफ स्मीयर टाइप्स हैं। थिन ब्लड स्मीयर, इट mainly used to detect the cell morphology and DLC. Thick blood smear, it is most useful in detecting the blood parasites, especially malaria extract, because of the examining large blood samples. Procedure: place to clean the glass on the smooth surface. Write the laboratory number of the patient on the slide. 2-3 drops at the end. Clean the slide. Thick blood smear. Hold another side. Hold it on another side. Spread the slide firmly in the horizontal position. Angle of 30 degrees. Just in front of the drop of the blood. Move backward. Spread. Touch the drop blood. Push the spread forward with the smooth move. Should be 1 centimeter from the edge of the slide and 5 mm width. ये इसमें फोटोज इनका आपको दिखाया हुआ है जो प्रोसीजर है वो। ब्लड फिल्म कैसे बनानी है। मेड ऑन क्लीन ग्लास स्लाइड्स, फिल्म में भी स्प्रेड बाय हैंड और बाय मींस ऑफ एन ऑटोमेटेड स्लाइड स्प्रेडर, मैनुअल मेथड जो आपको इसमें पिक्चर में दिखाया। स्टेनिंग ऑफ ब्लड स्मीयर, different structure we take stents using for parasite detection. Leishman stain is the most common and cheapest of all the stents. Leishman stain powder 0.5 grams, methyl alcohol 100 milliliter, dry blood film with curd. Leishman stain 1. After 1 minute, add the distilled water buffer on the blood film and mix well. Stain it for about 5 minutes. After 5 minutes, wash the slide and remove the cyst by the slide. Thin and thick methods. Examination of the blood smear. Inspection under low power node distribution cells where cells do not overlap. Switch to the oil immersion. Objective of the further examination. The examination should start to the thin end. Examine method of the slide is zigzag. Results: first focus RBC and check the structure shape, check WBC count, check the platelet count in different zones, change the parasite in RBC cell, check the cancer cells in the film. ये हो गया इसका सही। थर्ड क्वेश्चन इज शॉर्ट नोट्स ऑन हीमोग्लोबिन एस्टिमेशन। फर्स्ट है हीमोग्लोबिन एस्टिमेशन टू डिटेक्ट द एनीमिया और polycythemia disease and assess its severity. To monitor the patient response to the treatment, period donation blood. It does not done in the condition of the weakness, fatigue, shortness, breath, dizziness. Two methods of hemoglobin estimation is used in the labs: Sahil's method and Tolkist method. मोस्टली यूज जो मेथड है वो साहिल्स मेथड है। साहिल्स मेथड के अंदर है प्रिंसिपल: हीमोग्लोबिन इज सिंथेसाइज्ड बाय द मैच्योरिंग न्यूक्लिएटेड आरबीसीज इन द बोन मैरो एंड रिमेन इंट्रासेलुलर. द रेड सेल membrane is destroyed. Hemolysis by acid and hemoglobin pigment is released into the plasma in the form of the acid hematine. So the known quantity of the blood hemoglobin is mixed with N/10 HCl, leading to formation of the acid hematine, which gives brown color. Now mixture containing the acid hematine is diluted with the distilled water till its color matches standard color in the glass fitted in the hemoglobin comparator. So the color matching is done microscopically. Value of hemoglobin is noted down from the size tube. साइज ट्यूब के अंदर जहां भी कलर मैच हो जाता है वही उसकी वैल्यू रहती है। इसमें रिक्वायरमेंट्स हैं, 2 टेस्ट ट्यूब हैं, हीमोग्लोबिन ट्यूब है, हीमोग्लोबिन पिपेट है, हीमोग्लोबिन मीटर है, जो कंपैरेटर होता है जिससे हम कंपेयर करते हैं कलर ऑफ द सैंपल एंड कलर ऑफ द साइज मेथड ऑलरेडी गिवन। ब्लड सैंपल है N/10 HCl। ये इसमें इसकी फोटो है जो कि कैसा दिखता है। एक तो स्टील ग्लास रोड है, हीमोग्लोबिन पिपेट है जिसमें हम सैंपल्स को डालते हैं, साहिल मेथड है जो कि इन दोनों कलर्स के अंदर मैच हो जाता है, कंपैरेटर बोलते हैं इसको। प्रोसीजर ये है, फर्स्ट स्टेप, टेक द ब्लड सैंपल फ्रॉम द वीनस पंक्चर ETTA ट्यूब, टेक द 2 टेस्ट ट्यूब, one filled with distilled water and second tube with 0.2 microliter N/10 HCl. The hemoglobin pipette sucks 20 microliter blood mix in the second test tube with N/10 HCl, making the hematine. Leave for 10 minutes. After 10 minutes, second solution transfer in the hemoglobin tube. Normal values at the birth, it is 13 to 19 gram per deciliter. नियोनेटल्स जो कि बर्थ के जस्ट बाद है 14.5 टू 22 ग्राम्स, चाइल्ड 6 to 12 11.5 to 15, adult in the male 30.5 to 17, adult female 12 to 16। ये नॉर्मल वैल्यूज हैं। मेजर क्रॉस मैच involves the testing of the patient serum with donor cell, determine where the patient has an antibody which may cause the hemolytic transfusion reactions. This is the most important cross match. Requirement: test tube, glass slide, centrifuge machine, incubator, microscope and dropper. Sample: donor cell, antigen, serum of the patient, antibodies. Procedure: take the 2 test tube and label measure saline or measure album. Prepare 35% donor cell suspension in the normal saline. Take 1 drop of the donor cell suspension in each test tube. Add 2 drops of patient serum in each test tube. Add 1 drop of 22% saline albumin in the measure test tube. Incubate the albumin tube in 37 degrees Celsius temperature for 15 to 30 minutes. Centrifuge both of the test tube 1000 to 1500 RPM for 1 to 2 minutes. Observe the hemolysis accumulation of the tube. मेजर क्रॉस मैच का जो चार्ट है वो आपके सामने है। अब थर्ड आंसर, if the volume of the plasma is reduced from the whole method, the remaining fluid is collection in ECP. प्रोसीजर क्या है इसका? Whole blood is allowed to sediment 2 to 6 degrees Celsius temperature in the refrigerator and centrifugation machine. The whole blood on 2100 RPM for 8 minutes, low spin. After centrifugation, red cells are obtained as the sedimentation, plasma obtained as the separated. If the volume of the plasma is reduced from the whole blood, remaining fluid is collection in ECP. Supernant is transferred into the satellite bag from primary bag using plasma expose seal the tube and cut both the bags. Notes: saline, adenine, glucose, mannitol is preservative solution for the increased life of hemoglobin by 1 gram per milliliter. Plasma rich plates PRP, it obtained from the whole blood after centrifugation of 2100 RPM for 8 minutes. The sedimentation of PCB and upper supplement PRP. After configuration of PRP, obtained platelets in PPP. Answer D, ABO blood grouping. Aim to determine the blood group of the RS factor individual. Your blood type is determined by what kind of the antigen your red blood cell have on the surface. The test is essential for blood transfusion and planning to donate the blood. Not all blood group types are compatible, so it's important to know your blood group. The incompatible blood group can be dangerous for the immune system. इसमें क्या होता है, A, B, O एंड RH ब्लड ग्रुप, ये 4 टाइप के ब्लड ग्रुप होते हैं जो कि मेनली कंपेटेबल होते हैं। दिस ब्लड ग्रुपिंग सिस्टम इज बेस्ड ऑन एग्यूलेशन ऑफ रिएक्शन। जो सरफेस के ऊपर एंटीजन होते हैं उनके रिएक्शन से हम इन्हें डिटेक्ट कर सकते हैं। When the red blood cell carrying one or both antigen are exposed to the corresponding the antibodies, they interact with the other to form the visible aggregation or clumping. If RBC have antigen, then it will accumulate clot with antibody A, and RBC B antigen, then it will accumulate clot with antigen B. If RBC have both the antigens A and B, then it will accumulate or clot with both antibody A and B. If RBC have no antigen A and B, then it will not accumulate or clot with both the antibody A and B. Rh positive cells show accumulation with antibody D in optimum temperature and conditions. इसमें इक्विपमेंट होते हैं नॉर्मल सलाइन, एंटी सीरम A, B and D, pricking needle, tile or glass slides, dropper, application stick, toothpick, glass marking pencil, microscopes, frames. Procedure है clean the glass slide on the smooth surface में with A, B and D mark कर दीजिए उसे. Drop of anti serum A on A glass, anti serum B on B, anti serum D on D, and a one drop of blood in each A, B and D. Mix the blood and antibody with the help of stick and spread within 20 mm circle. Leave the slide for 1-2 minutes at room temperature. Look for regulation and protect the slide from drag. Describe detailed blood component and making the procedure of their use. Making procedure and their use. Blood components is composed of 55% plasma, 45% cellular components. A part separated from the whole body by different centrifugation and obtaining directly from the donor. A single whole blood donation can be separated into different components to provide the treatment more than patient. Whole blood. Centrifuge at 21 rpm for 8 minutes. We will resolve it for 6 weeks. The potential of human blood. Whole blood donation, red blood cells, fresh frozen plasma, concentrated platelets, and cycloprecipitates. These are the components of the bloods. 1 unit of non-separated donor blood collected in the suitable anticoagulant preservative solution CPD and ACD. Its total volume is about 400 milliliter, 300 milliliter of blood and 49 milliliter of anticoagulant. Whole blood is stored in 2 to 6 degrees Celsius temperature. Lifespan when the blood is collected in CPD anticoagulant, then its life is 35 to 42 days, 6 weeks near about. CPD citrate phosphate ACD acid citrate dextrose. Indication of the blood transfusion or clinical condition: acute blood loss, exchange transfusion reaction. Type of the blood components: PCV, paired cell volume, PRP, plasma rich platelets, plasma poor platelets, fresh frozen plasma, cyroprecipitate or centrifugation. Erythrocyte or PCV. Volume of plasma is reduced from the whole blood, remaining fluid is collection in PCV. Procedure. Whole blood is allowed to sediment for 2 to 6 degrees Celsius. Temperature refrigerator or centrifugation machine at the whole blood 2100 rpm for 8 minutes. After coagulation, red cells are obtained as sediment and plasma as supernatant. Supernatant is transferred to the satellite bag from primary bag using plasma exposure seal tube and cut both the bags. Saline adenine glucose mannitol. It's a preservative solution for and increase life of needle by 1 gram per milliliter. 1 gram per milliliter. Plasma rich platelets. It is obtained from the whole blood after centrifugation at rpm for 8 minutes. The sedimentation is PCV under supernatant PRP. After centrifugation, PRP obtained platelets and platelets. Concentration can be obtained from the single donor unit or by whole blood RDP, random donor platelets. It's obtained by manual method. Single donor platelet is obtained from automated method. Centrifuge the whole blood at the low speed. It increases the thrombocytopenia, platelet and transplants. Fresh frozen plasma, poor plasma quickly frozen -22 -80 degrees Celsius. Temperature is called PP. FFP. It contains all population factors, clotting factor. It is used to patient with deficiency of clotting factor. Also used treatment of patient with liver failure and vitamin K deficiency. Short notes. First, sickling test. Sickle cell disorder is an inherited blood disorder that affects the RBC. The sickle cell genes cause the body to produce abnormal hemoglobin. Each RBC contains 270 million hemoglobin molecules. Hemoglobin is the most important component of RBC. In this disorder, RBC develops C type cell. The RBC can block or blood vessels and it reduces the flow of many parts in the body. The result in the organ and tissue damage. A sickle cell test is a simple blood test used to determine the sickle cell disease. A single cell test is simple blood test used to determine if you have sickle cell disease or sickle cell trait. Sodium metabisulfite reduce the oxygen tension, reducing the typical sickle cell red cell requirement. Blood specimen freshly anticoagulated blood. Reagent 2% sodium metabisulfate. Dropper, pipette, slide, microscope or cover slide. Place a small drop of blood center of glass slide with the help of dropper. Add equal drop of sodium metasulfite with the help of pipette. Mix it carefully. Stick. Wait 15 minutes and examine under microscope. Positive result: sickling cell is visible immediately in the microscope slide. The cell becomes sickle C-shape. RBC are unchanged. It's reported negative test. You may not sickle cell disease. This type of cells, as in the circle seen, these are half moon cells. G6PD is deficiency in is an inherited sex-linked trait. The deficiency occurs in all the cells of the affected individual. It's more serious than RBC, more severe than RBC. HMP is means of providing NADP in erythrocytes. The decreased activity of G6PD impairs the synthesis of NADP in RBC. This results in accumulation of hemoglobin and preoxidase in erythrocytes, leading to the hemolysis. Jaundice, pale skin, rapid heart rate, red-brown urine, shortness of breath. Hemoglobin reducer test. Withdraw 6 ml of blood to the patient and add 6 ml blood into 1.2 ml ACD solution. Leave 3 test tube as ABC as follows. A test tube 0.1 ml sodium nitrate, 0.1 ml glucose solution, 0.1 methyl blue solution, 2 ml of blood. B टेस्ट ट्यूब के अंदर भी सेम ही रखना है. नाइट्रेट सॉल्यूशन, ग्लूकोज सॉल्यूशन, 2 मिलीलीटर ऑफ ब्लड. सी में 2 मिलीलीटर ऑफ ब्लड, मिक्स वेल एंड कीप ABC at 31 degree Celsius for 3 hours. Mix again and incubate for 1, 2 and 3 hours. 3 test tube each containing 10 ml of distilled water to 1.1 milliliter A test tube mixture. Second test tube 0.1 milliliter mixture with B. Third, add 0.1 milliliter of contained from C. Wait for 10 minutes. The test tube with distilled water and mixture add C test tube. So always red. The test tube with distilled water and solution B should always be brown. Test tube with distilled water and solution A. If this is red, there is no deficiency. If this is brown, expression of deficiency. If between red and brown, no expression of deficiency. Result: young cells have higher G6PD content than older cells. If the enzyme have efficiency activity, older cells are destroyed during the mild or moderate hemolytic anemia. RBC and WBC pipettes. Hemocytometer microscope covers sleep anticoagulant RBC pipette. RBC diluting fluid. Heinz diluting fluid. Sodium chloride 0.5 gram. Sodium sulfate 2.5. Mercury chloride 0.25. Distilled water 100 milliliter. Procedure: blood should be carefully drawn to the 0.5 mark of RBC pipette and excess blood should remove from the pipette. An isolation solution should be drawn to the mark 1.0 and dilute the blood. The patient blood and diluting fluid mix well and RBC pipette should be horizontal position for 30 to 5 minutes. Several drops mixed from the RBC pipette and to dry tissue. These are some tests. DU test. The red cell have the weak agent, so RH grouping do not show D agent. DU test detect a D agent on the surface of the RBC. DU test is indirect anti-globulin test using the patient red cells and immunoglobulin anti-D. Immunoglobulin anti-D must be used because anti-globulin serum contains anti-IG. Principal sign application: some red cells protest D antigen. It's expressed weakly that cells are not agglutinated directly with the anti-D sera. An anti-direction test necessary identify the patient weak. Reagents, equipments and supplies: 37-degree incubator, vast water, physiological saline, Coombs serum, Coombs control cell, all reagents, equipment and supplies in RH, centrifuge machine. प्रोसीजर इसमें आपको दिया हुआ है, आप चेक कर सकते हैं. Describe the combo test in detail with ICT. कॉम्बो टेस्ट और एंटी ग्लोबुलिन टेस्ट के बारे में है. कॉम्बो टेस्ट कैन बी यूज्ड टू डिटेक्ट द रेड सेल sensitization with immunoglobulin, auto antibodies and incomplete antibodies. Principle है the incomplete antibodies attached to the red cells membrane by immunoglobulin molecules. Direct comb test, indirect comb tests. Requirements and procedure है पूरा. The indirect comb test: presence of RH negative antibody, other weak antibody in the patient serum in case of the following. Requirements हैं टेस्ट इंटरप्रेशंस हैं जो कि इस टेबल से आप डिफाइन कर सकते हो. अगले शॉर्ट नोट्स हैं लंबर पंक्चर, डोनर सेक्शन, हीमोलाइटिक एनीमिया और न्यूबार चैम्प. CSR to detect the disease of the brain spinal cord including the meningitis and encephalopathy. इसे डिटेक्ट करने के लिए हम सेरेब्रोस्पाइनल फ्लूइड्स का टेस्ट कर सकते हैं. इसमें सैंपल कलेक्शन है. लंबर पंक्चर प्रोसीजर के थ्रू इसे हम कलेक्ट कर सकते हैं. प्रॉपर पोजीशन में ही होता है. ये इसका सही प्रोसीजर है और प्रॉपर पोस्चर है पेशेंट का, जिससे कि हम CSR निकाल सकते हैं. Second answer: blood donation is the process in which the blood donor as a specific amount of the blood gives for the purpose of storage in the blood bank. ये फिजिकल एग्जामिनेशंस हैं ब्लड लेने से पहले जो हम करने जरूरी है। मेडिकल हिस्ट्री जो पेशेंट की हो वो पूछनी पड़ती है, क्यों डोनेट करना चाह रहा है, सर्जिकल प्रोसेस हुए है कि नहीं है। 6 महीने से पहले अगर सोचो तो नहीं ले सकते। डिसीजन मेजर सर्जरी इंटरवल 6 मंथ का हो तो ही हम ब्लड ले सकते हैं। मलेरिया है नहीं है, डिसीजन डोनर आप खुद का है या फोर्सफुली है, ब्लड ट्रांसफ्यूजन 6 महीने पहले किया हुआ है। हेपेटाइटिस और HIV 12 महीने पहले हुआ। डेंटल सर्जरी अगर बेहतर घंटे पहले तो नहीं ले सकते। डोनर एड से है, डोनर ने कोई ड्रग्स ले रखे हैं, डोनर की हिस्ट्री हेपेटाइटिस B की है तो हम उसका ब्लड नहीं ले सकते। सिकल सेल एनीमिया पहले भी बढ़ाया हुआ है। सी टाइप के ब्लड्स RBC बन जाते हैं इसमें, तो ऑक्सीजन कैरिंग कैपेसिटी कम हो जाती है। थैलेसेमिया बीमारी है, इट इज इनहेरिटेड ब्लड डिसऑर्डर characterized by the formation of abnormal form of hemoglobin. It detects with synthesis of globulin chain of hemoglobin cause pre-mutual destruction of RBC due to membrane damage. मेम्ब्रेन डैमेज हो जाती है, RBC की जो उम्र है उससे पहले ही मर जाती है। थैलेसेमिया में अल्फा थैलेम में बीटा थैलेम दो टाइप की। अल्फा के अंदर डिटेक्ट अल्फा मेजर और अल्फा माइनर दो टाइप की चैन होती है। बीटा में बीटा माइनर और बीटा मेजर दो टाइप की चैन। हेरेडिटी होती है इसमें is abnormality of RBC or erythrocytes. The disorder caused by the mutation in the genes regarding the protein allow the erythrocyte to change in the shapes. G6 phosphate dehydrogenase deficiency जो हम पहले कर चुके हैं। न्यूमार चैम्बर और हेमेटोसाइटोमीटर और काउंटिंग चैम्बर है जिसे हम RBC काउंट। for your sport.